Who's at risk of hypertension?
Of course, there's also the family history, which is also very strong. Family history of hypertension. In other words, you are at greater risk of developing hypertension much later in the future if you have a family member, a first degree relative, either your father or your mother is hypertensive. Now, there's a way we do it in medicine when we want to classify risk factors. We say modifiable and non-modifiable, okay? The non-modifiable are the things you can do nothing about. The modifiable are things that you can do something about. For instance, having a family history of hypertension is not modifiable. You can't choose whether to have a parent who is hypertensive or not. So those ones, I won't talk so much about them, okay? Because what can you do about your father having hypertension? Were you the one who asked your father to have hypertension? Were you the one who said that your mother should be hypertensive? Do you get what I'm saying? Well, my emphasis will be on the modifiable ones. Those are the things you can do something about. And if there's anything that I will highlight, more importantly, as far as the risk factor is concerned, it will be weight. It will be being overweight and being obese. Being overweight and being obese. When I say all of this, when I mention those are risks, then we want to now talk about, okay, how can we, if you are at risk, how can you avoid it? Don't forget, today's session is talking about the way out. Hypertension. And if you already have hypertension, these things we'll be discussing are also very important for you. Sincerely yours, you don't have to have hypertension, you don't have to develop hypertension. There's a minister, a popular pastor who was interviewed recently and was asked the secret why it's still strong and all. He said, do they want to hear the truth? Do they want to listen to the truth? He said that his intentionality began when he was told by the doctor that he's hypertensive. Doctor, hey, what's the solution? The doctor said he has to be placed on drugs. He said, doctor, is there an alternative? The doctor said, yes, there's an alternative. What's the alternative? Lifestyle modification. If you can do certain things about your lifestyle, you don't need to be on drugs. And that's my message tonight. That's the emphasis. See, when we make a diagnosis of hypertension, the first thing is not drug. I'm not trying to sweet talk anything now. The only challenge is that in this part of the world, most people present late. And so by the time you are coming and we are making a diagnosis of hypertension, you already have complications. Those are not the people we want to say, oh, we want to lead them to try lifestyle modification. So the challenge is that people present late. We don't get to discover hypertension early. How can we discover hypertension early? Is by checking. By the time you are 30 upwards, there is a need to check your blood pressure. If you didn't hear anything today, if you did not hear anything today, please, once you are 30 upwards or you have a family history, in fact, some people need to check more frequently, or even they need to start checking at a very early age. People who have a family history of hypertension, people who are obese, or people who are overweight. Do you understand what I'm saying? We need to check pretty early because of our attitude to regular checkup. Many times people have had hypertension for like 5 years, 2 years before we discover that they are hypertensive, and by then we would have seen that beginning to develop complications of hypertension already. And that's why you don't give us doctors the chance to say, okay, we are not starting you on drugs. Normally, ideally, the first thing to do is not drugs, is to subject you to lifestyle modification and see how you fare on that. And there are a lot of people, this pastor I mentioned now, he's not on drugs. He's not on drugs. What he's doing is simply lifestyle modification, and his blood pressure is controlled. It's not magic and it's not rocket science. You get, there are some factors that when you, like I said, modifiable risk factors. Somebody who is obese, who is overweight, you lose weight, you become more active, you avoid sedentary lifestyle. When you do all of that, you do what we call DASH diet. I will still talk about all of these things, prevention. I'll talk about them. You do all of that and you do them religiously. Research has proven that your blood pressure can be controlled and you may not even need drug. And even if you are going to need drug at all, it will delay when you will need drug. Some have been on lifestyle modification. So even doctors, sometimes when we write our notes, you hear us say the person is hypertensive, but if the blood pressure is controlled, well controlled on lifestyle modification. So we'll talk more about the details of lifestyle modification. So I like it now, the need for regular checkup. The earlier we pick, the earlier the better. You know, that truism is most appropriate for things like this. The earlier the better. Hypertension is not something that just jumps on you suddenly now. No, it's not something that happens suddenly. There's a time you begin to see. In fact, there's something we call pre-hypertension. When your blood pressure is showing that it's not normal, but it's between normal and hypertension. You know, we say 90 to 120 on top, then 60 to 80 is the normal blood pressure. So, and we said that hypertension starts from 140 over 90 and greater. The question you're supposed to ask me is, what now happens between 120 over 80 and 140/90. Between 120/80 and 140/90. That's what we call pre-hypertension. Hypertension doesn't just happen. When people want to develop hypertension, people that are regular in the hospital, people that come regularly for other things, we have their vital signs checked. And when we check their vital signs, we begin to see that, okay, your blood pressure is getting high, not hypertensive, but getting high. That is the point when you begin to nail things, when you begin to hammer on lifestyle modification. So you see the importance of regular checks. Hypertension doesn't happen suddenly, it develops, and the best time to pick hypertension is when it's just developing or when it just started. And when we're able to pick it at that point, then it offers us the room to try what we call lifestyle modification. And trust me, you may never need to use drugs. There are people who have been placed on drugs, and by the time they're able to lose weight and do some of the things we're going to be talking about, blood pressure was very much controlled. And so it's possible, it's doable.